this committee to order, and with that I'd like to entertain a motion for approval of the last month's minutes. Supervisor Sokol, seconded by Supervisor McDevitt. Any additions or corrections to the minutes? All right, then we'll vote. All those in favor?
Aye.
Opposed? Carried. Thank you. And I'll turn it over to you, Chris.
Good morning.
Good morning.
I guess we kind of go in order from simplicity to more complex, I guess. But I have several items. Usually this meeting is of the year we have these items, so there's nothing really unusual. The first one is a request to amend the county budget to add TRADE Act funding. We had a student who was approved for $7,000 in TRADE Act funding. This is just a pass-through for the county, so they can go through.
All right, Supervisor Sokol, you're making the motion on that?
Yes, please.
Second to that motion, Supervisor McDevitt. Any discussion?
Thank you, Madam Chair. You said this happens every year. Is this part of the budget, or is this like, wow, we got $7,000?
So what happens is, people get approved first, and then we get the award. So this happens occasionally during the course of the year. There's really no magic that it's today versus it just happens to be one of those approved.
But this was totally expected last August.
No, we never know. We never know when.
Put the seven. Is this a bonus to our budget?
Well, sort of. Like we're just a pass through. It's a bonus to the student to receive that money.
Oh, the student receives the money.
Yeah. Well, it gets paid to the training educator, the training center. I can't remember if it was Sioux Adirondack or BOCES.
Okay. In this case. Now I understand. Thank you.
Right. All those in favor?
Aye.
Opposed? Carried. Thank you.
The next one is the Summer Youth Program. Last year we received $109,237. Each year it goes up a little bit to adjust for the increase in the minimum wage. This year we are expecting $117,541, and the distribution of how the funds are proposed to be spent is included on page 4 in the resolution request. You'll see that the vast majority of the funds go into part-time salaries for the youth, over $63,000.
Would someone like to make that motion? Supervisor Loeb, seconded by Supervisor McGowan. Any questions?
Yeah, I just said on the summer retirement there, is that for the youth? Sorry, Chair.
All right, go ahead.
No, it's for staff. It's for staff. Yeah, part of the money is used to pay staff expenses, to monitor and manage the program.
All right. Now we'll vote. All those in favor?
Aye.
Opposed? Carried. Thank you.
The next one, and by far the largest, is a request to amend the county budget to add grant funding. This is our formula funding under the Workforce Investment and Opportunity Fund for program year 2019. This year we're expecting $724,883. This is up significantly over the current year of $587. We knew that the overall federal budget was level funded, but New York actually received about 20% more than the current year, and you see that in our numbers as well. Needless to say, we were thrilled.
Oh, I guess.
It's been very lean the last few years, and the amount of money that we spent on training has reflected that. So we were excited that we got a bump in funding this year, so we'll be able to put more people through training.
Very good. All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor McDevitt. Any discussion? Supervisor Loeb.
Thank you, Madam Chair. Unexpected bump in the funding. Is this federal?
It's federal funding, and so what happens is Congress just approves a lump sum, and then there's a formula, which is part of the reason why they call it formula funding. There's like 8 pages of calculations that are made to determine how much each state and then each locality receives. And it's all based on demographic information, unemployment rate, number of workers that are dislocated, etc.
Thank you. Thank you.
You're welcome. Any other questions? All right. Oh, I'm sorry, go
Oh,
ahead.
Chris, this time last year, as I recall, I think funding was a little bit tight on the administrative side. Does this alleviate that?
It does.
Okay.
And I'll talk about part of that when we look at the, when you look at the next item of...
Okay. All right, we'll vote on this one then. All those in favor?
Aye.
Opposed? Approved. Thank you.
So the next request for resolution is for temporary positions and training slots. And one of the things that I did this year, and this is on page 8, this is a resolution that gets passed every year to go along with our budget. This is the actual authority to put people into training. And one of the things that you will note is I put the dates down. Typically, we just put the date at the top, saying July 1 to June 30, which is the program year. But the way the funding is actually, comes in, if you look down under youth employment programs, we can actually begin spending the youth money on April 1st. So the award comes out and it says you can go retroactive to April 1st. And so that was how we were able to handle our budget shortfall for the current year, is by being able to forespend the money for the following year. I mean, we can only do that once, so it's a good thing we got the boost in money so that we next year level and not have to worry.
All right, thank you. Let's get it on the floor, a motion to bring it to the floor. Someone like to make that motion? Supervisor Driscoll, seconded by Supervisor Sokol. Mr. Driscoll, you had a question?
Just one question. Is that a 2-year award, Chris, or it says 21?
Yeah, so most of the money, we can begin spending it on July 1st. We have 2 years to spend it.
Okay, all right.
Yep.
Thanks.
All right, thank you. All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
And then the last resolution request is to reappoint a member to the Saratoga-Warren Washington Workforce Development Board. Karen Winnie, her term expires on June 30th, so it's just a request.
All right, someone like to make that motion? Supervisor Sokol, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Opposed? Carried.
And then just under information, the Workforce Development Board has made a decision to cut 2 members from the board. They've been having a hard time getting all of the members to attend meetings, so they thought it might be easier to fit quorum if the size of the board was smaller. They're going from 29 to 27. We will be losing one of our representatives. I had alerted the county administrator to that. This board doesn't need to do anything. It's an informational point only. But if there's any questions, certainly I can address them.
All right. Do any of the committee members have any questions for Chris? Anyone in the audience have any questions? I guess we're good on this then.
Great, thank you.
Thank you very much, Chris. Enjoy the rest of your day. Nothing changed. Good, how are you?
My motorcycle helmet was getting too big. Too small.
You can only lift 60 pounds now.
Thought we had a new supervisor.
You need a haircut?
Probably the shortest it's been in 40 years.
Okay, Rob, go ahead.
Okay, good morning, everyone.
Good morning.
My first item is resolution request. It's actually on 2 separate forms because it's a request to appoint 2 individuals to the Warren County Community Services Board. Our Community Services Board has 4-year terms, and we fill unexpired terms. Both of these are due to resignations of individuals, so the nominees would be filling unexpired terms that For Belinda Bradley, the term would go through December 31st, 2021. And for Cindy Wasson, the term would go through 12/31/2022.
All right, someone like to make that motion? Supervisor Driscoll, seconded by Supervisor Loeb. Any discussion? All those in favor? Aye. Opposed? Carried. Thank you.
Thank you. My next item is a request to host meetings, and for those that aren't familiar, we go through a process every summer with our contract agencies. In May, we put out a call for their budget proposals, and then we have a budget review committee of the Community Services Board that meets with the agencies individually to review their proposed budget for the upcoming year. So this summer, we're reviewing 2020 proposed budgets, and because we have 7 or 8 different contract agencies that we work with, we have to do this over a period of 2 separate days. Our days this year are June the 10th, 12 to 2, and June 27th, 12 to 2. And again, just in order to try to make it easier on folks, we start over the lunch hour, provide a very light, modest lunch. So the request here is the expense of $100 for the 2 days. We have about 12 people, so you can see that's not a very expensive lunch. We do pretty basic.
Looks that way. All right, someone like to
Cheese and
make...
crack.
Yeah, cheese, a few vegetables, I guess. Mr. McDevitt makes the motion. A second to the motion? Supervisor Loeb. All right, all those in favor? Aye. Opposed? Carried.
And I did just have one informational item, if I could. I included in your packet a handout. May is designated as Mental Health Awareness Month, and I would like to thank the chairman for passing one of the resolutions, proclamation for May as Mental Health Awareness Month in Warren County. I thought I would just provide the committee with a handout of just some information about mental illness and mental health. Statistically, we know that about 20%, or 1 in 5 adults in America will experience a mental illness. 4 to 6% is more likely the number of adults and actually children that suffer with more serious mental illnesses. And the individuals with more serious mental illnesses are more of what our service system generally works with. So if you think about the population of Warren County, maybe around 65,000, then the 1 in 5, the 20% would be somewhere around 13,000 individuals impacted by mental illness. For the more serious mental illnesses, we would think maybe around 2,600 or so. So we know that mental illnesses are medical conditions that disrupt people's thinking, feeling, mood, and abilities to relate to others and daily functioning. Just as diabetes is a disorder of the pancreas, mental illnesses are medical conditions that often result in diminished capacity for coping with ordinary demands of life. The more serious mental illnesses that I mentioned are things like major depression, schizophrenia, bipolar disorder, obsessive compulsive disorder, panic disorder, PTSD, and borderline personality disorder. We do try to promote the message that recovery is possible, and we don't think of recovery necessarily as like you get your treatment and you get over it. The serious mental illnesses are often things people learn to manage better and deal with throughout their lives. Dimensions here, the peer support groups, and we've recognized the importance of peers in the mental health community and the value that has to other people in sort of developing those kinds of recovery concepts and management skills for managing the illness over their life. There's some bulleted points there that just, point out some things that you could see. World Health Organization has reported 4 of the 10 leading causes of disability in the U.S. Are mental disorders. By 2020, major depressive illness will be the leading cause of disability in the world for women and children. Without treatment, the consequences of mental illness for the individual and society are staggering. Unnecessary disability, unemployment, substance abuse, homelessness, inappropriate incarceration, suicide, and wasted lives. The economic cost of untreated mental illness is estimated at more than $100 billion each year in the United States alone. Best treatments for serious mental illness are highly effective. Between 70 and 90% of individuals have significant reduction of symptoms and improved quality of life with a combination of medication and psychosocial treatments and supports. We also know that there's a very high co-occurrence with substance abuse disorders. They estimate approximately 50 to 75% of individuals with a serious mental illness also have a co-occurring substance abuse disorder. So, again, I just wanted to highlight that. The source for this was the National Alliance of Mental Illness. The New York chapter has a website that's cited on the back there. Anybody that's interested in any more information or ever wants to visit any of our programs, just let me know.
Thank you, we appreciate that. We appreciate the information, too. Anyone from the committee have a question?
Yeah, on the last point there,
Sure.
about the stigma and the eroding efficacy of efforts and whatnot, are we working on various things to overcome those barriers?
Yes, we work very closely with our Mental Health Association, which is one of our contract agencies, and they do a lot of promotion in the community to try to combat stigma. But, I mean, obviously, I think we're making some progress, as a nation, nationally. But, it's tough. It's tough because that stigma persists. So it's tough to overcome.
Supervisor Driscoll.
Thank you, Madam Chairman. As a follow-up to Craig's comment, I think Mental Health Association is being challenged with their proposed building, and some of those stigmas are coming out through the media, and I hope that it all works out and that the right decisions are made. It seems like they're going to be. Every once in a while, it's resurrected, and I think certainly it's being put to the challenge at this point. So, thank you.
Supervisor McGowan.
Yes, thank you. My question is, it seems like it says by, 2020, the major depressive illnesses will be the leading cause of disability in the world of women and children. Are they finding this becoming, more of a hereditary, a gene being carried on from family to family? I know, especially like depression and that, seems to carry on from families and that, but, some of the other...
many mental illnesses do have a genetic component, yeah.
And it's a shame that it's getting worse, because life is becoming so much easier every year that we pass. And, I'm just hoping they can, find something where they can reverse this trend. It's such a shame to suffer with these. So, thank you. This is very informative.
And they are developing new medications, new treatments all the time, so, yeah.
Anyone in the audience that has a question? No, I guess we're all set. Thank you very much, Rob.
All right, thank you.
Mhm. Have a good day. uncomfortable chair, Dee.
I've noticed that. I'll tolerate it for a few minutes.
Okay. We're all set.
The first item on the agenda is permission to do a budget amendment to increase our revenue codes to reflect moving some of our district monies, the New York State Delivery System Reform Incentive Payment Program, into the budget so that we can start spending these monies.
All right, motion by Supervisor Sokol, second by Supervisor Leggett. Any discussion? Supervisor Bramer.
Thank you. I see on the second page, it looks like a lot of that is going towards equipment and supplies. Is that normal, or what is that?
Well, there's really no clear guidelines as to what you can use the district funding on. It just has to be utilized for Medicaid recipients and then to deter hospital admissions, things such as that nature. So what we've been using it for is we purchase iPads for the staff so that when they're out in the community, they can look up things on the internet right away. We can also process things faster, so it increases productivity. We also purchase new computers for the office. And then we purchase things such as pill boxes, reachers or grabbers, night lights. We've come up with a listing of all the emergency phone numbers and laminated that to give to our clients as well. And then the next thing that we intend to spend it on is new electric meal transporter carriers for our home-delivered meals so that the meals will stay a lot hotter and we can serve more individuals that way.
Very good. All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
The next item is permission to submit our 2019-2020 New York Connects grant application in the amount of $203,636. All of this money is 100% funded, and there's no county match.
Someone like to make that motion? Supervisor Driscoll, seconded by Supervisor McGowan. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
The last action item is permission to fill the mill site cook number 4 position at the Cedars meal site due to resignation. The base salary for this position is $27,438. It's a 35-hour-a-week position, and we should see an approximate cost savings of $3,220.
All right, someone like to make that motion?
I have a question.
All right, could we bring it to the floor first, and then we discuss it? Is that all right?
Sure.
Okay. Supervisor McGowan, seconded by Supervisor Loeb.
Yeah, just
McDevitt.
have you ever broken down in terms of what someone is making per hour based on this situation here? 24,000, what is that per hour?
For a grade 2 position, it's approximately $13.19 an hour.
Okay. Good.
Supervisor Bramer.
Why are we reducing the salary? I mean, 27 is already pretty low.
We're not reducing it. It's just going to be a cost savings because the person in the position had a certain number of years.
Right.
So that's where we're seeing the savings. We're not reducing anything. The position's staying exactly the same.
Explain that to me again, please.
Okay.
Because it's... Go
There's
ahead.
no reduction in hour. There's no reduction in the hourly wage based on a new person. It's just that the person that resigned from the position had 10 or 15 years of service in, so that's where you see the reduction in the overall cost.
Like a new teacher coming on board.
Right.
Retires, the teacher comes on, they're paid at the start of the year, teacher longevity.
All right. Yes, Doug, thank you.
I'm sorry.
But no, you're right, that's exactly right. All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
And the next two things are just informational. I attended the 2019 Lifespan National Respite Conference in Buffalo. It was April 30th through May 2nd. I was not there an entire month. And then Roseanne O'Rourke and myself would be attending the ACU conference at the Desmond Hotel from June 10th through the 12th.
Good. Glad you're keeping up on all that. That's good. All right, any committee member have a question for Dee? Ms. Bramer?
Thanks. Can I have a copy of the resolution request for number 3? It was not in our packet. Thank you so much.
All right, any other questions? Anybody from the audience have a question? Doug?
Thanks, I'm hearing some great things about the new lady at Cedars. I figure her name off the top of my head. What's her name?
Nikisha Peters-Dashnoff.
Yes, I've had 3 different people come up to me and tell me what a great job she's doing. And I think the rapport she's built, I guess she's a very hard worker. So that was a great hire, and it seems like things are settling down there, and at least the feedback I'm getting from residents, I'm glad he's getting that's a good hire thing.
Good. Thank you for sharing that. I think we all need to hear that too, so I'm glad you had that. All right. Anything else, Dee?
No.
Anyone from the audience?
You want to keep that?
Yes, we're all set then. And thank you very much, Dee.
Thank you.
Keep up the good job.
About a year or two ago, on Frank's strong recommendation, they fix employees, I think a minimum of $15 an hour.
What the hell are we doing paying someone who works 35 hours a week $27,000? I don't understand.
How does someone make it on $13 an hour?
They don't.
They don't, that's the answer.
First time.
And then she's
I don't
kind of doing this about it.
I don't understand. So the last person was the same position but a higher grade, so they got paid more.
I think just time in the job, you know?
Well, it doesn't.
Right. This is that. You would think by now that I would. I mean, I understand, but the whole government thing, like civil service, just because you've been there so many years, you just get you get more than someone else who's doing a better job than you. I hate that.
I don't know what the...
No, what happened there?
Let's raise salaries.
Maybe I better take
Really what it boils down to.
Or just take her.
Give that person the $3,000. I don't care. What's it to us? Versus what it means to that person.
Means a lot to that person.
Chris, he's a little slow.
And yet we'll hire some administrator at $85,000. Or pay Jason $200,000. Poor Jason. I like to pick on him.
No, I had some time, and I went in,
She didn't say why that person resigned, do we know?
she went and tested for it.
Struck them quickly, you know.
Actually, I was trying to get it to look like Ryan, but
Trying to throw her
No,
out
I
there too
think
bad.
Jason's got the best
I
job,
did
the best
think
job in the
that would
county.
look like it.
Well, no,
Oh, my
he's,
gosh, you
I
kidding
saw him
me?
the other night and it was like, he was out and he
No,
was
no, I
going back to
didn't
the
have
office
one.
and
Mental
prep
health.
for,
Okay, we're all set for social
he was getting ready to
services.
prep for a grand jury trial and then that murder happened. I'm sure he's,
Morning, everyone.
that's a stressful job.
All right, I have somewhat long agenda here. I'll try to go as quickly as possible through it, though. The first action item is to seek a resolution to amend the table of organization to create and fill the position of Case B supervisor, grade 20, which is a base salary of $49,557. This is adding a Case B supervisor to our child protective unit. The rationale is that the caseloads have made it necessary to place the second Case B supervisor in Child Protective Services unit. There has been, as everyone I think is aware here, an increase in CPS work over the years, and we have amended the table of organization over the years by adding some caseworkers and a senior caseworker, but what's happening now is we're bottlenecking at the top for approvals. So we are asking to add this position. The position is mandated and reimbursed. I brought Tammy Breen from Child Services. She's the grade A Child Services Supervisor over CPS, foster care, adoption, home finding, and preventive services. If there's any specific questions in regards to how this will work and how it will alleviate some of the overtime and the work.
All right, well, let's bring the motion to the floor, then if the committee has any questions, someone like to make that motion? Supervisor Driscoll, seconded by Supervisor Sokol. Questions? Ms. Bramer?
Sure, I'd love to hear how it's going to help. So if you look at, I think you all have a copy of the proposed organization chart in your packet.
What number?
Page.
I didn't see the table.
It's number 1.
Oh, she made copies.
Sorry about that.
Thank you.
They were.
They are good.
Thank you. Would you like one? Yeah, sure. Yeah, a couple. Go ahead, Tammy, it's all right.
So the way in Child Protective Services, when cases are reviewed by a supervisor, they're first reviewed by the senior caseworker, and then all the cases are ultimately approved by the supervisor. So currently what's happening is because we've added casework staff on the front line to assist with getting our overdue numbers down, we're bottlenecking at the top, as Chris said. So the goal will be to improve workflow, get cases approved quicker, so then it's decreasing our overdues, hopefully to also decrease the amount of overtime that we're having in Child Protective Services. And the current grade B supervisor is completely bogged down with supervision of the unit on top of other administrative duties. We're also looking to bring our fair hearings to be, right now they're currently under a senior caseworker, to under the new grade B supervisor. It's really more of a supervisory duty, and we're getting more and more requests for fair hearings, and they're taking up more time. And we have to meet with our legal unit on those, prepare for those.
All right, thank you. Any other questions? Supervisor McGowan?
Has this all been budgeted?
Yes. That's
We're
something
not
that
asking
Julie
to
can-
increase our budget for 2019. We're hoping empty positions that we're not paying out will cover the cost for 2019. However, it will affect 2020. There'll be an increase for that position.
That means we'll discuss that at budget time then? That you'll have-
Absolutely.
Okay.
It's one of the things that we've also discussed in regards to keeping it under the cap, so we have discussed that a bit. The other thing is that one of the things that Tammy didn't mention is that she alluded to it in some of her discussion, but the current grade B supervisor supervises about 17 people, which is, if you look at the org chart, you'll notice that's quite a bit more than any other supervisor. Basically, I mean, there's departments in the county that are smaller than 17 people. So it's a lot of responsibility. It will cut down a little bit on overtime, regular overtime. Of course, it won't affect the CPS after hours overtime because that's outside of the regular business hours that we have to have 24-hour, 7-day-a-week coverage through the year. So there's a number of factors here why we decided that we really needed this position.
Okay, any other questions? Supervisor Driscoll?
Thank you, Madam Chairman. Chris or Tammy, are there preventive strategies for bringing the fair hearings, to decrease them or bring them more in line with, better information sharing or that type of stuff?
That's not really something that's in our control. When a case is indicated on a child protective report, every person has a right to ask for a fair hearing. One thing that is currently in the legislature, I'm not sure if it's going to be passed, when we indicate a CPS report right now, it's based on some credible evidence. When it raises up to a fair hearing, it's at a fair preponderance of evidence. There's a bill right now that's out there that says CPS will indicate unfair preponderance, and then the fair hearing would also be fair preponderance. So that may impact it, but at this time, we really don't have any control over those numbers.
Okay, thanks.
All right. Ms. Bramer?
Thanks. What is this KBS person that's just sitting out here?
She's the keyboard specialist for Child Protective Services.
All right, any other discussion? Boy, this is a long one.
Well, you know, it's such an issue, you definitely have a lot of people working on Child Protective Services. The trend in the county relative to population, how are we doing with?
Numbers are up, and it's not just us, it's statewide. I just got an email yesterday from other directors of services asking how different counties are set up, because turnover's been an issue, although knock on wood, we've been pretty good with turnover right now.
With your employees?
With the employees, we are fully staffed, again, I shouldn't say that out loud.
We should all knock.
We have 3 new CPS caseworkers who just finished training at the end of last week, so they'll be able to begin taking CPS reports. But not only are numbers up, cases are more difficult. It's not just a standard ed neglect case anymore or parent substance abuse. There's so many different layers of a case that cases are taking longer to work on as well.
Supervisor Beatty, yes, I saw your hand up.
Thank you, Madam Chair. So I see where the increasing caseloads have made it necessary to place a second case B supervisor in Child Protective. So can you give me an idea on what the actual increases are? How many, you're saying it's increases per caseload? Is that 5, is it 10, is it 100, is it? I'm just trying to get a handle on that.
Well, the state recommends that CPS caseworkers carry anywhere from 12 to 15 investigations. We currently have caseworkers who have 20 investigations or 21 investigations. So our goal by adding the workers was to bring those down. And now that we have new staff trained, we'll be able to start giving them investigations so caseloads will lower.
Okay. So, yeah, I understand some have 20, some have 12 or 15 of them, and it probably fluctuates all the time. I guess what I'm trying to grapple with is maybe if you told me, well, in 2017 we had 500 cases, 2018 we had 600 cases, 2019 we're on the pace to do 7. You know, that would give me a better idea.
I don't have the numbers with me for what we had in 2018 for number of investigations. I believe it was well over like 1,500 investigations.
Well, would you know if that's more than the year before?
Each year we're steadily increasing. Not by a lot, but we have been increasing over the years.
Okay, so that helps me a little bit. Thank you.
All right, Ms. Bramer, your hand was up first. Claudia, did you have something?
Thanks. It's only tangentially related. What is the average time from when an investigation starts till when the child has permanency or the investigation is closed or that kind of thing?
Well, when an CPS investigation gets open, they have 60 days to complete an investigation. That doesn't always mean that an investigation is done within 60 days. It depends, again, on caseloads. We've had higher number of overdues lately than we would like. But when you talk about permanency for a child, if a child is removed during a CPS investigation and placed in foster care, then we start to look at permanency, and we really want to, have a child have permanency within 15 or 22 months. If that doesn't happen, if they're not reunified in that time frame, then we're going to court to, ask, speak with parents about a surrender or TPR.
What is our average time frame on that latter process?
I think it varies greatly depending on which court you're in. The cases can be litigated for long periods of time if a family has more resources available or if they get the right attorney. So sometimes they can be in court for, a couple of years, 3 or 4 years sometimes. We're mandated by the state to file a TPR 15 out of 22 months. So we do that. We can start the procedure at about 12 months if we think it's really not going to be resolvable. But we are at the mercy of the courts and whatever else might come our way via attorneys or associated players in these cases. So,
years is a long time for kids.
It's a very long time, and that's why this 15 out of 22 months law is in place, so that kids do not have to be in between their biological family and their adopted family. So, one of the things that, we try to do is, over the years, we've had a number of initiatives to try to reduce that, and I think it has been becoming a shorter period of time overall. We have less kids in care today because of that, because if kids do come into care, we are able to get permanency quicker one way or another. And we have less kids who are getting placed in care because we're working on trying to keep children with their biological families. So it varies greatly from case to case.
Supervisor Garrity, I saw your hand.
I just applaud them for being able to have full staff over there. This is one of the toughest jobs.
Oh, I agree, and just think of the number of children that are involved. That's what amazes me, how many children we have involved in this. So,
All you gotta do is pick up the paper every day and read something that's going on.
I know it.
I applaud them for being able to manage.
I agree. Supervisor Beatty, then I want to call the vote on this.
Just one last comment. I know our student population in Warren County is going down. Yeah, we have less kids in school and so forth. Yet we're increasing in child protective services, the amount of children needing, your help. So that's a very alarming trend. Less students, less kids, more cases. That to me is not a good trend. And Mr. White had mentioned to me one thing that, maybe substance abuse, which is on the rise significantly in all counties across the country, could be a significant factor or a factor in this disturbing trend. So, you guys do yeoman's work. Children are our most, valuable possessions, and no one can disagree with that. So, I'll probably support this if it goes to the board or personnel adding this position. I think it's worthwhile.
Thank you, Mr. Beatty. All right, I'd like to call the question on that. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you. Chris, next.
The next request resolution is to fill 2 vacant positions of keyboard specialist number 4 and number 7. This is a grade 3 position with a base salary of $28,026. These positions are open due to promotions within the department. Positions are mandated and reimbursed.
All right, someone like to make the motion. Supervisor McDevitt, seconded by Supervisor Bramer. Any discussion? Supervisor Bramer?
Thank you. How many hours do these individuals work a week?
They're full-time positions, so they're 40 hours a week.
All right, any other discussion? Supervisor Bramer?
What is the current poverty level right now?
It depends on the family size, but it's interesting that you bring that up because we've been having this discussion recently about how many people actually work for social services that qualify for services at DSS. I think, the threshold, if you have 2 or 3 children, even one child, and you're making $28,000 a year, you are going to qualify for a lot of services. Unfortunately, these jobs are not super high-paying jobs, and it's one of the things that we've started discussing because there's contract negotiations coming up. We're really, in support of workers getting a higher salary because, as you've known, we have a lot of turnover over the years. We've lost some key players all throughout the building over the last several years because they found jobs that did pay more money with the same benefits. So we're pretty, concerned about that. We know that the salaries are quite low for the level of responsibility, work, and knowledge that they have.
Yeah, well, I just want to make a quick comment. I mean, I want to be careful with the county's money and where we spend it. I also want to be fair to the people who are working for our county. Our employees should not have to qualify for our services when they're full-time employees and they're knowledgeable, they're doing a good job, and they're working hard. They shouldn't qualify for our own services.
Agreed.
Supervisor
A
McDevitt?
lot of casework staff who actually work 2 jobs.
Exactly.
Right.
Right. And they're
Just like we
caseworkers are
saw
hired.
that with the cook at Office of Aging.
That's the reason I asked you that question, okay? This is, I think, a problem nationally with not an easy solution. So one of the criticisms of Walmart nationally is that we have people working full-time jobs that qualify and receive food stamps. So, you take that analogy and you draw it out to some employees in the county, and I don't know where we go with this.
It's a strange situation.
Yeah, it is,
We have
yeah.
people that actually work in food stamps who qualify for SNAP.
Yeah.
It really shouldn't probably be that way.
Oh, embarrassing.
It is.
True. Embarrassing
We
for...
have to work with what we have to work with, though.
Right. All right, any other comments? Mr. McGowan, did you have anything you wanted to?
No, thank you.
Okay. All right, let's call the vote on that one. All in favor?
Aye.
Opposed? Carried. Thank you.
Number 3 is a request resolution to fill the position of Social Services Investigator number 3. This is a grade 11. Base salary is $38,225. This is due to a retirement effective June 24th. Position is mandated and reimbursed.
All right, someone like to bring that to the floor, please? Supervisor Driscoll, seconded by Supervisor McGowan. Any discussion? All those in favor? Aye. Opposed? Carried.
Number 4 is a request to continuation of contractual relationships with agencies listed in Schedule A for special delinquency preventive programs for 2019. The programs include alternative sentencing, home-based parent education, and youth and family counseling.
All right, Supervisor Sokol makes a motion, seconded by Supervisor Loeb. All right, any discussion? All right, all those in favor? Aye. Opposed? Carried.
One abstention, Madam Chairman.
Yes, make note of that, please. Thank you. All right, Chris?
Number 5 is to request a resolution to renew the contract with the Council for Prevention of Alcohol and Substance Abuse for a youth court program for 2019. Total amount not to exceed $67,295. This is basically a pass-through. We get the money and we pass it on to these programs. This is a youth court program that serves youth in Warren County, and we've made some adjustments in how some of this money is distributed based on past discussions we've had here in regards to towns that were not getting any money in the past but now will.
Okay. All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor Loeb. Discussion. Yes.
Just clarification, I was speaking with some of the staff regarding the funding for this program. This funding is earmarked for youth courts. Okay.
All right, all those in favor?
Aye.
Opposed? Carried. On to number 6.
And number 6 is a resolution to request an agreement for 2019 with the City of Glens Falls, towns of Queensbury, Lake George, and Warrensburg to provide certain youth services for the Department of Social Services Youth Bureau for a total amount not to exceed $1,715. The rationale is Glens Falls, Queensbury, Lake George, and Warrensburg provide certain youth services for youth residing in those municipalities. This is what I was alluding to in that last resolution, a separate carve-out piece of money that goes to these towns. And it is indicated in there how much each town will get based on their contribution, so it's prorated to make it fair.
Okay, sounds good. Someone like to make that motion? Supervisor McGowan, seconded by Supervisor Loeb. Any more discussion? All those in favor? Aye. Opposed? Carried.
Let's see here. Number 7 is to request a resolution to amend the 2019 county budget to increase revenues and appropriations in the amount of $75,000 to reflect the following 2 new allocations. First is New York State Office of Children and Family Services Family First Transition Fund. This has been established to assist in providing local districts with funds to support the recruitment and retention of current and prospective foster families. $30,000 will go to that. And 2 is the New York State Office of Temporary and Disability Services Homeless Management System to support connectivity to local HMIS and other actions related to homelessness in our county. That would be $45,000. Family First regulations are forthcoming. This is going to be a big change to the work that we do in our Children's Services Unit. There's a lot of regulations and changes that need to be made. Right now, this is all apparently going to become effective in 2021. Well, actually 2020, right? They got a 2-year extension from 2018. So in October of 2020, we'll be subject to these regulations. The other one, the Homeless Management Information System, is a system that we can put information in, and we can also extract information in regards to helping people achieve a more permanent home placement if they are homeless.
All right, someone like to make a motion, bring that to the floor? Supervisor Bramer, seconded by Supervisor Loeb. Any discussion? Supervisor
Thank you,
Leggett.
Mr. Chairwoman. Chris, on the Homeless Management Information System, this is used by caseworkers?
Yeah, that's used by workers at DSS. So it's a system that the state has that we are now going to be able to access and use. And we are getting money towards that, so it's, we're taking in the revenue to pay for that access as well. Our workers will be able to use this system. We also have, if you remember from a former committee meeting where we had asked to create this position of case manager, who will be half at DSS and half at Countryside, they will have access to that system as well to aid in homelessness.
All right, Supervisor Bramer.
Thank you for that info. On the Family First program, what are we using those monies for?
Those monies, well, I think Tammy can speak to the specifics that we're going to use it in our county for. They can be used for a lot of different things. It just has to be related to, researching and creating resources and assets that are going to help us go forward with this new, these new regulations. So, you can explain that, Tammy?
A little bit about Families First. Like Chris said, when it comes into effect for us, there's going to be huge changes regarding how we place children in congregate care. So if we have to move a child from a local foster family, to congregate care, there's going to be many more stipulations. OCFS and the federal government want to reduce the number of kids that we have in congregate care. So we have to look at what supports we can put around the foster families that we have to try to maintain the children in regular foster care.
When you say congregate care, is that like St. Anne's?
Yeah, it's like an institution, yeah. So we've decided that with this $30,000, and it's just like a 1 year, we're going to get these funds for 1 year to try to help transition us into this, is to improve retention and recruitment of foster families, and also what supports any monetary help that we can help our current foster families to support the children that they have in the home. So whether it be, setting up some meals for them, if there's additional costs that aren't covered through regular foster care, working on really getting out in the community to do some recruitment and retention, and also if we have kinship families that are interested in providing care for relatives, what can we help them do to be able to get certified to become a kin foster family? So that's what we're looking to do with that money.
Thank you, Tammy, for explaining that. All right, any other questions? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
We have no pending items, and I've attached an activity update report to your packets, and I guess Julie would be up next.
Okay.
The revenue and expenditure report through April 2019. I don't have any concerns at this time. If anybody's had the chance to look at it, if they have any questions, but for the fourth month of the year, we're still doing okay, both with our expense and our revenue based on that expense. And for our overtime report, we're still a little high. As Tammy said, though, our last free caseworkers just got done with their core training, so that will reduce quite a bit of the training overtime costs. We also have RTA unit is getting quite a bit of overtime because they were down 2 workers. Both positions have been filled and they both have started. So we'll see a reduction there as well.
Any questions from the committee? All right, thank you, Julie. We're now on to Amy from Countryside.
Just a quick, I wanted to thank Chris for your commissioner's activity report.
Oh,
Nice to be able to...
you're welcome.
Yeah, it's nice to have it in writing and take a few minutes to look it over.
Look at it at your
Yep,
leisure.
exactly.
Yeah.
Listening
Thank
to me
you.
discuss it perhaps.
It is nice to have those.
Give you an idea of some of the things that are going on and such.
So should we increase the your supervisor salary from 13,000?
Good morning, everyone.
Morning.
To your supervisor
The first
salary.
request I have is,
You
would like to be able to do fill vacant position institutional aid number 3, or number 2 rather, raise pay. It's a base salary of $28,026. The reason is promotion, so when we have a promotion in the building, we're a 24-hour facility, so we just, one person moving changes the entire building. So we ended up with one 32-hour position left, and it is a mandated and position.
All right, someone like to make that motion? Supervisor Sokol, seconded by Supervisor McGowan. Any discussion? All right, all those in favor? Aye. Opposed? Carried. Thank you.
My second request is I'd like to submit a membership to ESAL. It's at a cost of $1,344 for 1 year. It's based on $28 per bed, so it won't be any more than our max occupancy of 48 beds. This membership discusses regulation. It's a good go-to. You don't call the Department of Health because you want to see how they interpret the regs for the facility. I also was looking online. They're a good PR resource. They help with training at a discount as well, and we're required to have 60 hours every 2 years.
But this is something you haven't had before, or whoever was at
From what I
Country.
understand, the previous director did have a membership, but it didn't carry over.
Oh, okay.
I heard that through one of the people that I was talking to at ESAL.
All right, someone want to bring that to the floor, please? Supervisor Sokol, seconded by Supervisor Hyde. Any discussion? Supervisor Sokol.
Is this budgeted? You have this
There's one.
available?
Yes, we do.
And Supervisor McGowan?
Thank you. So I guess my question is, do you think the benefit for the cost per year would outweigh the cost?
Yes. Just having this membership alone will drop the cost of the regulatory training that I have to do by $100. The advice and being a go-to source will cut down on that. I mean, it's a really good resource, and there's a lot of people in the that belong to this membership.
All right, any other questions? All right, all those in favor?
Aye.
Aye. Opposed? Carried.
My next
Go ahead.
My next request is to correct resolution number 151 of 2019. It's the renewal of the dietitian services. The correct amount should have been $42 per hour and a 2-year service agreement versus the 40 in 1 year. It inadvertently, the old service agreement got signed for the resolution. My rationale is, first of all, we do have the money budgeted. second, it's very difficult to get a dietitian for Warrensburg. And she's been more than adequate maintaining the services that we need. I think it would be beneficial to both her and the facility to do a 2-year.
All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor Bramer. Discussion. All right, all those in favor? Aye. Opposed? Carried. Thank you.
The next request is to continue our service agreement with Beely and Equipment. They do a semi-annual inspection of our fire suppression system in the kitchen. The approximate cost is going to be $700 for each inspection, not to exceed $1,500 annually. And it is required.
All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor Loeb. Discussion. All those in favor? Aye. Opposed? Carried. Thank you.
Another service agreement, Mahoney Fire Systems. They inspect the water system, fire alarm system, twice a year. The amount wouldn't exceed $11.50. And they do have prevailing rate that has gone up a little bit at $184.50 per hour for after hours, weekends, and holidays. I've worked for 28 years. I can't remember when we've needed to call them after hours or on a holiday. It's usually just the 2 inspections a year.
All right, someone want to make the motion? Supervisor McGowan, seconded by Supervisor Driscoll. Any discussion? Supervisor Driscoll.
Thank you, Madam Chairman. I noticed one of the backup documents listed Mr. Corcoran's name, and I guess my question might be to Mary or Ryan. As a practice, when we have agreements, this one was with Kevin Mahoney, Mahoney Alarms. I mean, are we required, or is it good practice to make those changes on, I guess, legal documents, contracts, agreements?
Yeah, we'll update that.
Okay.
I didn't make Mahoney's aware that Mr. Corcoran was
Okay,
no
that's
longer
fine, yeah.
with us.
Yes.
You guys didn't know that Ed wasn't there.
All right.
For April, our census remained at 35. We had 1 admission and 1 discharge, so it kind of evened itself out.
All right, we need to go back to number 5. I'm sorry, we didn't go to that one. Did we have a first and a second? All right, all those in favor? Aye. Opposed? Carried. Thank you. Amy, I'm sorry.
I know you want to get back up to Warrensburg.
Yeah.
Okay, so yeah, the census, 35 for April.
Okay.
1 admission, 1 discharge. And the overtime has gone down considerably. As you can see, it was only 5 hours for the week of 5/12. As we're filling positions, things are getting better.
Very good. Any questions from the committee? Any questions from the audience? We covered everything, Chris. Yes?
Thank you very much, everyone.
Thank you.
Amy. Nice rest of your day.
You too. Thanks for the good job.
Good job, Chris, as always.
Thank you.
Yeah.
If anybody let me know about that, make sure you never have a fracture.
I can argue with that.
I think we do because he held out.
I don't know how to change that situation with the salary.
We have to answer unless we support TSA and they front and then they
How are you?
Morning, Mr. Sokol. How are you? What you doing out there? Living the dream.
Checking the horse status.
Yeah, is that what he's doing? I'm kind of thinking.
Checking the horse status.
Good morning.
He's giving me gray hair. I've had a wisdom blood flow tomorrow. Doesn't want me to come down, doesn't want to come home and recuperate, not having it done up here. You know how bad that is?
Oh, it's not bad at all.
I'm a little nervous. I know, but I don't think he realizes the anesthesia, how is he going to get home? Oh, he's young.
Pull them out.
And that's what she said.
Or are they putting them under?
Yeah.
Oh.
Sure.
He does. That works. That works.
But it's an improper practice for us to give them a raise.
Oh, whatever. I'll figure it out. How's Holly doing?
Okay, we all set, Janelle? Okay, we're ready.
All right, my first resolution request is to amend Resolution 405 of 2018 and contract with Field Goods to increase the contract amount by $1,400 for a total of $4,300. That's attachment 7. Health Services application was approved for a public health improvement project, and that was through AHI, or Adirondack Health Institute, which includes funding to purchase and distribute fresh produce to women, infants, and children at WIC clinics. Initially, the contract for Field Goods was $2,900, and an increase is requested due to available $1,400 funding for the project.
All right, someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Loeb. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried.
The next request is to authorize a contract with Glens Falls City School District to provide Committee on Preschool Education Services to Warren County children who are eligible. This is attachment number 8. The contract would increase availability of services for CPSC children in need. Services are provided at a rate set by the state and are reimbursed at 59.5%.
All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor Lowe. Discussion. All those in favor?
Aye.
Opposed? Carried.
The next resolution request is to authorize a contract with Kimberly Lawson, an occupational therapist, to provide occupational therapy services for home care and preschool programs at established current rates, including an automatic annual renewal unless termination is requested from either party with 30 days written notice. This is attachment number 10. Health Services continues to be in need of service providers, including occupational therapists, to serve clients. The agency must have the capacity to accept referrals and meet client needs, so therapy services are billable and revenue generating.
All right, someone like to make a motion on that one? Supervisor Sokol, seconded by Supervisor McGowan. Any discussion? All right, all those in favor?
Aye.
Opposed? All right, carried. Thank you.
The next resolution request is to amend the budget to reflect funding received from Adirondack Health Institute to support Delivery Systems Reform Incentive Payment Program, which is DSRIP. That's attachment number 6. Tom Driscoll will...
Basically, that we've received district funds over the last couple years, and it's all in deferred revenue. As we use it, we are going to move it over, so I talked with the treasurer's office with some things that we're going to need this year, so we need to move the money over. So I'm moving over $50,000 for this year, anticipation of new laptops we still need for our, some of the nurses and some of the therapists that we weren't able to get the first time. Other equipment is our telemed monitors. We're going to need 10 new ones, and that's about the price that we're expecting. We want to get those going pretty soon too. That helps us with patient continuity and checking on their statuses every day. About $3,000 in supplies expense, which we have some cameras and keyboards and things related to all of this. And the last is $16,000 for data processing. There's this thing called Hixney, which is supposed to be a I'm trying to think of, like, I guess where we can contact a doctor's office, they can contact, we can share information. So this is a data that software that they have to add to our system. They're working on it, they're working with others on it, so that's our portion of the cost. They were hoping for it to be done by June. I don't know if it will be. They've had some changes. But again, I've got to move the money, so when we get bills, we'll have that money ready for that. So that's all district funds that we've already received. not costing the county anything, I just have to move it over into our budget.
Okay, very good. Someone like to make that motion? Supervisor McDevitt, Supervisor McGowan. Any discussion? Supervisor Leggett?
Thank you, Chairwoman. On the data processing, is that for the purchase of the software? Is that annual license fee? How is that?
I think it's for them to work on and purchasing the software. It's something that's being mandated by New York State, and so there are other people who are also involved in this for them doing this whole incorporation. I'm not sure, I don't know if you know, or Tammy, waving your hand over there, because you would know. You want to help us here? Sure. That was Tammy's.
The software vendor that they're using, Delta Health Technology, New York State is requiring something that's unique to New York State. If you go to the doctor's office, you sign a form, a HICSI form, basically that says that they can share your data. So that's what's happening. So they're going to share with patients, send that data from health services will be shared so that the primary care physician that also sees the patient will be able to grab that data. So it could be encounter data, it could be diagnosis data, it could be med reconciliation, all those things in hopes. And the reason that district will fund this is because they're hoping that it will provide better care across the continuum to patients. So it's because it's unique to New York State, the software vendor is requesting the company, the counties, or the agencies in New York State that utilize their software to chip in to cover the cost of the upgrade to the system and the programming that is going to go behind the scenes in order to be able to have this interface built.
Thank you for that explanation. Appreciate that. Any other questions? All right, all those in favor? Aye. Opposed? Carried. Thank you.
And then next is transfer of funds, which is your last page, attachment 11. That was added last minute, we did that last night. Our bioterrorism grant ends June 30th. In the midst of, we've had a per diem liaison that we have not fully been able to fill that position. We had somebody for about a month and a half, and they left, and so we have some funds left. So we want to move the money from part-time salaries down to get some things that are needed, which is some computers, a printer. We just did our pod, and we need some of these things to keep things going. We didn't have these things, we found out, and also a router we need, and some supplies that may be needed. So I'm moving money. The first one is moving about $5,000 out of part-time salaries to buy this equipment and these supplies. The second request, again, is bioterrorism related. Again, we had an employee who last year was working within the program, part-time, per diem like. She's still doing some of that, but she is a full-time employee now. So just in the budget, her salary was put in part-time. I just got to move it up to full-time. So that's about $5,600 I'm requesting. So those are just transfer funds within the bioterrorism agency department.
Okay. Thank you. A motion? That resolution, please. Supervisor Loeb, Supervisor McGowan. Any discussion? All right, all those in favor? Aye. Opposed? Carried.
All right, there are no pending items. For information, for discussion and review, funds up with the report of expenditures and the revenue and expense comparison.
So attachment 1 are current financials as of May 21st is when we printed this. At that time, we had not closed the month of April. We have since then closed that. I don't have those numbers, but they'll be added, obviously, in the next month's numbers. Again, if you'll notice our salary schedule and information at the bottom, we are below in regular salaries. We're still remaining consistent with our overtime salaries, which are still consistent with our new computer program and documentation, and our part-time salaries are pretty much even to last year. Overall, we're 31.19% of the budget this year, and last year at this time we were 37.75% of the budget. So overall, we're 33,727 under last year at this time when it comes to total salaries. On attachment 2, which is comparing last year to this year. Again, the salaries information, which we just discussed. Equipment, we just purchased a Ford Escape, which we needed a four-wheel, all-wheel drive, again, for the North Country primarily, but we do rotate our cars, so those cars are coming back down here, and then when it gets bad weather again, and probably late fall and early winter, obviously, we'll transfer and rotate. We try to rotate them twice a year.
Okay.
Contractual expenses, again, there's a difference there, and when I did compare last year to this year, it is still related to our preschool program. getting approvals and getting everything, they're out there, but we can't pay them until we have a state approval, so they're pending, but they'll catch up eventually. Employee benefits, almost a break even, we're down about $3,900, but overall, and again, just bring to your attention that the retiree health as of this year is $82,164. Revenues are just slightly under. Again, we are in the process of closing the April billing, so that'll catch up with that too.
Any questions? All right, for status of referrals, that's on attachment number 3. Val is out today. We're showing negative 25% from where we were last year. But if you look at March last year, we were down negative 37, so looking at that, maybe March is kind of a down year for referrals in general. But the census is still low at the hospital, and we do get referrals from other sources, but overall, we're seeing the same trends that other home care agencies are also seeing.
Okay.
So on attachment 4, that's the emergency response and preparedness report. Just one edit to note on 523 and 524. That was an in-person ICS, which is Incident Command 400 course, and Pat Belden also participated in those 2 very informative days. And rabies report is attachment 5, and just to note, May is Rabies Awareness Month. So our fight reports and things are listed there. There are a couple rabies clinics that are announced that are also on that report. And for an informational item, there's an attached authorization to attend a meeting or convention. Christy McGavey, our public health nurse, will be attending Home Care Association's Patient-Driven Groupings Model Coding Essentials in Schenectady on June 12th. The cost of the conference is $399. Funding is available in our budget.
Oh, any questions from the committee? That was pretty short, Janelle.
Making up for last month.
No questions from the committee. How about any questions from the people in the audience? If not, then I guess I can entertain a motion to adjourn. Supervisor Loeb, seconded by Supervisor McDevitt. All in favor?
Aye.
Thank you, ladies. Great job as usual.
Okay.